Do you feel like others often mumble when they speak? Do you get frustrated because you can hear people talking but just can't understand the words that they're saying? Are you so tired of asking people to repeat themselves that sometimes it's just easier to pretend you didn't hear them at all? If you said yes to any of these questions, you're not alone. For nearly a decade, I asked others to repeat themselves and avoided situations when I knew it would be too difficult to hear. And I struggled with everyday conversation, but didn't think I had a hearing loss because I could still hear. Now, if we were talking about our eyesight, we wouldn't think twice about seeing a doctor if our vision was even just a little blurry. But for some reason, when it comes to our hearing, we hesitate. My name is Heather Sager, and I've worn hearing technology for 8 years. And today I'm sitting down with Doctor of Audiology, Tony Miliano, to explore the topics I wish I would have known about years ago when I first started noticing my hearing change. We're going to explore the realities of hearing loss, the latest advancements in hearing technology, and what you need to know before deciding who to work with to take action on your hearing. So let's welcome my special guest, Doctor of Audiology and owner of Audiology and Hearing Centers, Tony Miliano. Hi, Tony.
Hi, how are you, Heather?
I'm doing great.
Great, thank you for having me here.
Absolutely, we're so glad you're here.
Thanks.
Let's just dive into this and get started.
Super.
I want to understand a little bit more about what is hearing loss. So can you talk to us a little bit about what hearing loss is and what we need to know?
Well, first off, there are approximately 48 million individuals in the United States that suffer from hearing loss. There are basically two different main types of hearing loss. First, you have a conductive hearing loss. This kind of hearing loss is involving the bones or the eardrum inside the ear, and can even be something as simple as like impacted earwax inside the ear. Many times if a person has a conductive hearing loss, it's something that can be medically treatable through either surgery or medication, like an ear infection, or getting rid of that earwax. The second kind of hearing loss is a sensory neural hearing loss. This is what people commonly have referred to in the past as a nerve hearing loss or a tone-related hearing loss or a pitched hearing loss. This kind of hearing loss is typically from damage to the nerve fibers inside the inner ear. And with that kind of hearing loss, there typically is no surgery or medication that can restore that type of hearing loss. So often the treatment option of choice is amplification or hearing aids.
That's great. Between the two, the conductive and the sensory neural hearing loss, which one is more prevalent?
Overwhelmingly, the sensory neural hearing loss. We generally see in our practice about 80 to 90% of the individuals with hearing loss have a sensory neural hearing loss. So there is no medical or surgical treatment at that time. When we identify hearing loss, there's a huge difference between hearing and understanding. And the sensory neural hearing loss typically is the kind where you mentioned earlier in your introduction where you feel like you can hear, but you can't really understand. You can't make out the words clearly.
Oh, that's so important to distinguish between the two because it is one of those things that when you're dealing with hearing loss, when you can hear people, you think, oh, it's not so bad.
Right.
That you must not need to see anyone to get help because you still can hear.
Right.
So that is a really interesting myth that I think a lot of people are challenged by.
Right. See, there's a huge difference between hearing and understanding. The way it works is the way our speech sounds are distributed throughout the speech range or the speech frequencies are that the sounds that are most important for understanding our speech are primarily those high pitch or high frequency consonant sounds like the S and the F and the TH. Those sounds give our speech that sharp, crisp sound that allows us to understand. Typically, when a person has a sensory neural hearing loss or nerve-related hearing loss, it develops in the higher pitches or higher frequencies first. So speech sounds a little more muffled, maybe a little more garbled, just doesn't have that sharp, crisp sound that you need to understand.
I mean, that would make sense around where oftentimes we hear someone say something, but we're not quite sure what the word is, or we mistakenly get the word wrong. That happens quite a bit.
For example, you might hear the word pool, but you understand something different like tool or white and wife. And that happens all the time.
Yeah.
In our practice, we refer to that as a sound void. It's a moment lacking clarity or understanding where you hear, but you just can't understand. You just can't quite catch the message or the full message.
Yeah. You know, sometimes in some of those moments it can be funny, but more often than not, it becomes pretty embarrassing or frustrating as the person who's not getting the words right.
Yeah. Yeah, that happens a lot of times as people will laugh it off as if it's humorous or something of that nature, but it hurts. When you have a hearing loss and it develops over a longer period of time, those jokes aren't quite so funny anymore.
Yeah.
And eventually when we see someone who wants to come into our office to actually look into evaluating their hearing loss, it's some type of triggering event or a relationship that has compromised as a result of the hearing loss. So that's when we find people want to take action.
I would imagine many patients don't even realize that they have a hearing loss. So why do you think it takes so long for people to actually acknowledge something's happening?
It's typically because the hearing loss develops gradually over a really long period of time. Prolonged noise exposure or age or heredity, but it can be creeping up for 10 to 15 years or more before it really starts to create that communication handicap, where it really starts to impact their ability to hear and understand. And over time, people, without being intentional about it, develop a lot of coping mechanisms. Mm-hmm. They start avoiding certain situations. They start avoiding certain restaurants, or they make a lot of excuses. Well, so-and-so mumbles, or they just don't teach people to speak plainly, or this restaurant's too loud. So a combination of those factors is why people generally wait, up to 10 years sometimes.
Yeah, they say on average it takes about 7 years
Right.
for us to, once we acknowledge there's something going on, to actually take action and do something about it.
Correct.
So, but there's something beyond. We're talking so much about the person who is dealing with hearing loss, around how it impacts them. But I was so surprised to understand that my hearing loss impacted more than just me. So
That's
can you
right.
talk about the greater impact that hearing loss has on a person and others?
Well, really, the hearing loss is a silent disability, and people don't acknowledge someone with the hearing loss as a disability because it's not visible. You can't see it. They don't know. And it impacts relationships. At the core, it impacts your ability to communicate with your spouse or other family member or loved one. It impacts your ability to enjoy some of the activities that you once enjoyed, such as going to church or a simple, outing to a restaurant or something like that. You eventually either can't understand in church, so you just kind of zone out and say, well, I'm just going to pray if I can understand. Or eventually I've seen a lot of patients that actually stop going.
So for me, I always thought about those situations around how you mentioned before, how I coped in whether it was going to church or getting by at work. And I figured that if I was able to navigate it, it was fine. But it wasn't until I actually sat down with a doctor of audiology and was forced to answer some questions with my husband, where I started to hear his perspective. And I was always frustrated asking him to repeat himself, but I never considered how frustrating it was to him to always have to think about how he was speaking, or for him to have to regurgitate information over and over again.
It's interesting because in our office, we will provide a survey to the patient that measures the impact of their hearing loss in their lifestyle. We also give a survey to the companion, be it a spouse, a family member, maybe a child bringing in a loved one. Inevitably, the companion always rates the impact of the hearing impairment worse than the actual patient themselves. Yeah. So it has a far broader impact. For example, in your case, you have young children. So those higher pitched voices are much more difficult for you to hear. So it impacts your ability to enjoy those special moments, like if they're just playing on the ground and, making noises with their little cars and things like that. You can't hear those little conversations that are going on. And that's important for you to catch all that.
And it's important for them too. I think about some situations where my son has asked for me across the room, or even with hearing technology, sometimes it's not perfect, that I just imagine what he might feel like if he can't actually communicate with me.
They'll come up and try a couple times to maybe say something or make a comment to you, but eventually they get frustrated and they just want to run away.
Yeah.
Kids are like that.
So speaking of kids, we have a really great example of one of your patients that you work with. She and her father have had quite the dynamic around his hearing loss over the last few years, and you had the opportunity to help them navigate that in their family. So why don't we take a look for a moment and see how hearing, and how more importantly a solution to hearing, has really made a big impact for them.
I was away at school for several years, and then when I moved home, I noticed that my dad's hearing had declined pretty dramatically. When we would sit down for family dinners at night, and my brothers and I would be carrying on conversations, he just couldn't keep up. I think it became pretty isolating for him because there were certain tones, come to find out, that he was not hearing. And we could just tell he was more withdrawn from those conversations. So that was really the catalyst that got us to say, Dad, okay, it's time to schedule an appointment. Let's go in. Let's just hear what the options are. Let's get a hearing test done to see if you truly do have an impairment.
So what has life been like for you after seeing the Audiology and Hearing Center team?
Well, I mean, his personality, my dad's personality, is back to what it was in terms of being very engaged in conversations. And if we're somewhere together early morning before he's put his hearing aids in, I can tell a dramatic difference from before and afterwards. I think he's been pleased, very pleased.
So now that we've talked about hearing loss impacts more than just the patient and their family, I'm curious to know, are there any negative consequences for someone not choosing to take action quicker?
There actually is a significant impact or consequence of not treating the hearing loss. In addition to deteriorating that relationship with friends or family like we talked about earlier, there's a link between hearing loss and dementia and cognitive decline. There was a study out of Johns Hopkins University that found that individuals with hearing loss were 2 to 3 times more likely to develop dementia. And once the dementia started, it progressed 5 times more rapidly. So
Wow.
There's a big impact on not treating the hearing loss.
Wow, that's fascinating. Are patients surprised to hear this when they talk to you?
They are surprised. They had no idea. They just thought that it was their own little cocoon that they were experiencing with this hearing loss. But it turns out that another study out of Duke University found that treating hearing loss was twice as effective as any medication on the market. So their recommendation was to treat the hearing loss first.
Tell me a little bit about the types of patients who come into your practice.
We see a full range of patients, anywhere from young adults all the way to mature adults, and the full range in between.
And when they come in to see you and you find out that yes, indeed, they do have a hearing loss, what are the typical options for them for treatment?
Well, first off, when they come in, we not only want to find out if they have a hearing loss, we're going to look at their clinical history. We want to find out if they have any indications of having any medical problems, medical pathologies that might be related to the hearing. We want to find out how much they hear. We also want to find out how that hearing loss is impacting their daily lifestyle and their communication. So is it impacting their ability to hear maybe in a conference room or at church, in a restaurant, or hear the children or grandchildren, things like that. So we really want to dig a lot deeper into how it's impacting the entire person and not just what they can hear, what they can't hear. Treatment options vary widely. It could be that they have a medical problem and we need to make a referral and get some medical treatment. Hearing aids are also a very common treatment option as well. So 80 to 90% of the people that we see in our office do not have a medically related hearing loss. So the only option to improve their hearing is hearing aids.
People need to understand what hearing technology actually does, because I think this is a misconception that goes with what we talked about right at the beginning, which is the difference between hearing and understanding.
Right.
So can you talk about the concept of rehabilitation and really what does hearing technology do for a patient?
Well, hearing technology is only a single part of the overall rehabilitative process. With the hearing aid itself, what we do is we evaluate the hearing, determine the ranges in which they hear at certain frequencies, determine the degree of loss, and then we come up with a prescription on that basis. But that's only a single element. When I see a patient, I like to think of it as kind of like a three-legged stool. As to where each one of those legs has to be of equal length and strength, otherwise that stool is not going to stand up straight. Well, in this particular case, we have the technology, or the hearing aid have to have the right appropriate technology. Then we also have to have the commitment of my staff and my team to make sure that we help your hearing needs now, but also as your hearing needs change down the road. And then the third leg of that stool is the commitment of the patient to that rehabilitative process, because it's not an immediate fix.
So speaking of technology, I know there's some really exciting advancements that have come out recently that you and your team are working with. So can you talk about some of those new exciting features?
Well, the biggest exciting feature right now is that the hearing aids are tiny and discreet. So people are worried about that, or people are going to see the hearing aids and this and that. And the answer is no. They're very discreet, very inconspicuous. And we also have that Bluetooth connectivity. So we can connect to televisions and telephones and stereo systems and all those sorts of things. And it's controlled right through your smartphone. So when you want to make an adjustment and you're out in a busy, crowded restaurant, you simply open your smartphone, make an adjustment to your hearing aids. That way your peers don't have to know you're making an adjustment to the hearing aids. They don't know if you're checking a text, an email, or anything else. So, and what we do is we take those situations where you were struggling, the ones that are most important to you, maybe at work and in restaurants and places like that, and we customize a treatment plan specifically for your individual listening needs.
That's one of the features that I love the most, that connectivity between my ears and my phone. And not only can I stream music, but I actually can talk to my kids when I'm traveling. It's so great, and I'm sure that's a really added benefit for so many of your patients. That's
a big game changer nowadays.
Yeah. You mentioned before the TV component. So talk to us a little bit more about that, because that's actually my favorite feature.
It's a little tiny piece that we hook to the TV that allows you to stream the sound from this piece or the television directly into the hearing aids. So that way you as the hearing impaired person can control the volume at whatever level is comfortable for you, and then the rest of the friends and family can use the TV remote and control the volume that's comfortable for them.
Yeah, peaceful home evenings all
Everybody
over the nation. Such a great thing. So with technology, it's incredible, especially for patients who've never worn it before. It's life-changing. But are there benefits for someone who might be wearing technology now? Would they find benefit in some of this newer technology?
Yes, they can, because there's technology now that can do things that hearing aids and technology even 4 or 5 years ago couldn't do. There's many reasons why people might want to consider upgrading or considering new technology. A combination between progressive hearing loss, maybe decline in hearing aid performance, or advances in technology. So many times people who have made that switch to new technology have said it's significant because of the connectivity with the television or their phone, or maybe now they have something more discreet than what they used to have. So there's a lot of reasons that they might want to consider changing.
Yeah, and we have a really great example of that. One of the patients that you've worked with recently, he just upgraded to an incredible new technology that's come out, and we're going to hear from him right now.
I was in the Army, and I went to Vietnam in 1970. And I was right across the street from an ammunition dump. Well, when the rockets came in, this is when I think I lost my hearing. But probably 20 years ago, I noticed that I kept having to say, huh, and what, and that kind of thing, which after a time it gets embarrassing. So I decided to go have it checked. And sure enough, I did have 80% of hearing loss.
So that's how long you've worn technology?
This is my third set of hearing aids, and the first ones were completely in the ear, and the second set was over the ear. And then about a month ago, I asked Dr. Miliano, I said, what's new, Doc? I mean, something out there I should have? And so he recommended these.
Tell me about, you mentioned being able to talk to your family on the phone. Mm-hmm. How has being able to directly stream that into your ears, how has that transformed your relationships?
A lot of times when they were out of town or they were traveling, they would talk to me on the speakerphone on their car. There's no way I could understand them, and I was just struggling to hear them. And now I can hear them just as plain as day.
Think about if somebody was watching today and they have hearing aids too, but maybe they were like yours, a few years old. What advice or recommendations would you have for them?
I know there's probably some people that are satisfied with what they have, but there's a lot of us out there that like to have the most up-to-date. So I did simply because of the quality of life. I wouldn't trade them for anything now.
What an incredible testament to just how far technology has come, even the last few years.
Right.
So let's say someone has determined, okay, something's going on. I'm ready to talk to an audiologist or talk to someone about taking action. Tell me a little bit about what choices do patients have when it comes to taking back control of their hearing?
That's a great question, Heather, because many times people don't understand the differences and the different options that are available. The first option is an ear, nose, and throat physician. These are medical trained professionals that have 4 years of college and 4 years of medical school. And then beyond medical school, they do a residency that is specifically in the treatment and diagnosis of conditions and disorders of the ear. The second option is a hearing instrument dealer or hearing instrument specialist. These individuals have a minimum education requirement of a high school diploma or a GED, and they pass a test that's administered by the state licensing board. This is generally going to range anywhere from a private office to a big box store, where you're typically going to find like a free hearing test, something like that. And the reason that it's free is because the only reason that they are allowed to test hearing by the state licensing board is strictly for the purposes and sale of a hearing aid. As a doctor of audiology, myself and our practice, my associates, Dr. Whitney Cope and Dr. Jared Anderson, we are doctors of audiology. We have 4 years of college education and an additional 4 years of doctor of audiology training, and then we specialize in the non-medical treatment of hearing loss.
So seeing a doctor of audiology, does that cost any more for a patient?
Actually, it doesn't. It's actually more affordable option a lot of times because most of the hearing losses are not medically or surgically treatable, so there's no need to see a medical physician. If we identify that there's a medical pathology or indications that there might be something going on, then we can make that referral. So a lot of times, it's the more affordable option.
And you mentioned before that you have 2 associates on your team, Dr. Cope and Dr. Anderson.
Right.
Tell us a little bit about, beyond being doctors of audiology, what makes audiology and hearing centers so different than the other choices?
Well, in addition to being the only doctors of audiology in the area that are focusing strictly on, clinical diagnosis and treatment of hearing loss, we are the only options for individuals who can get amplification or hearing aids from a doctor of audiology in this area. But that's not the important part. The important part comes before that. As a doctor of audiology, we're going to focus on identifying not only the cause of the hearing loss, why you had the hearing loss, but the underlying conditions. We're going to identify the situations where you most have difficulty understanding, where you find that you're having communication difficulty, and then we're going to build a customized treatment plan based on those solutions.
There really is a difference, and you feel it in your office. And in fact, I was speaking with one of your patients earlier this morning around just the difference an experience can make.
I never heard real well even when I was a kid. I guess it's from hunting and farming and things of that nature.
What made you come into Audiology and Hearing Center?
My wife convinced me to go and get a hearing test. I more or less went to satisfy her. And I was so impressed when I got down and seen Dr. Milano. He put me in that room. But I waited a year and a half or 18 months or something like that. And then my grandson come along. We was in the hospital and he was being born. We was trying to hear, all that going on. I wanted to hear his first cry, and I was hearing everything but what I wanted to hear. And I told my wife, I said, I'm getting hearing aids next week. Anyway, and I ended up going to another place up there, and they demonstrated another set of hearing aids, and they was very pushy. The hearing aids that they had was, they just wasn't quality hearing aids. Well, in fact, I scheduled the appointment again in their parking lot. So anyway, come back, and I've got these now, and the first time I held that grandbaby and was able to hear all the sounds that a baby makes. Best money I've ever spent.
What an incredible story that he had. I mean, kudos to you and your team for obviously making such a big impact, not only on him, but so many patients every day.
Thank you.
So we've had the chance to listen to quite a few of your patient stories today, and we've learned what is hearing loss. And for those who are watching, they might be thinking, okay, there's something going on here, but they might still have some questions.
Sure.
So I want to ask you a few of the most common questions that patients have when they come in to see you. Is that
Great.
okay?
Yeah, super.
All right. So let's just get right to it.
Okay.
We've talked about the treatment process includes technology along with a few other things. But at the end of the day, why does hearing technology cost so much?
That's a great question. I get that question a lot because it is an investment, but it's an investment in your relationships and your lifestyle. The reason hearing technology costs so much is because there's a lot of research and development that goes into the technology. We now have the processing power inside a tiny little piece that go inside your ear that's the equivalent of a laptop computer. So there's a lot of research and development that goes into developing that technology. There's also a commitment to that rehabilitative process. It's not a simple retail transaction. It's a commitment. It's kind of like a hip replacement. So you have to have the most appropriate appliance. You have to have a talented surgeon to put the appliance in. but you also have to have that commitment for quality rehab and follow-up care. Otherwise, you're not going to have the result that you want in the long run. So in this case, we need to have the most appropriate technology, and you have the commitment of my team and myself to make sure that we meet your hearing needs now and also down the road.
And I know it sounds so cheesy to say, but I'm going to say it anyways. It's how do you really put a dollar figure on such a transformation in your relationships and just the quality of your life?
That's a difficult situation for a lot of people, and it's something that they really struggle with. We have a lot of options to try to make it affordable. We have a wide range of technology that can fit a lot of different budgets. And when it comes right down to it, a lot of patients, they have to consider the budget.
So what options do they have when it comes to that? Does insurance cover it? Are there financing options?
We do have insurance that covers approximately 20% of the time our patients have some insurance. So many times people don't even know that their insurance was covered it. So one of the things that we do in our office is we call the insurance company every single time to verify and see if there's any coverage. Many times we're surprised pleasantly. When that's not an option, or even if it is, to cover the patient expense, we have some financing options available, and some of them are even 0%.
Another question that we hear often from patients, everyone's had an experience where they know someone who has had hearing aids before. So in the back of their mind, they might be thinking, but what if these don't work for me?
Right.
So what would you say to them?
Well, there's a couple different things that I want to point out in that question. First off is all hearing needs are different. Just because hearing technology didn't work out for a friend or a family member doesn't mean it won't be right for you, because we don't know. Did they have the right technology? Were they fit properly? Did they have that quality rehab? Did they have the follow-up care that was necessary to ensure success in the long run? So if in our office we have patients that aren't successful in the long run, for whatever reason, we offer a 75-day trial. So they have the opportunity to go out to the restaurant, spend time at work, spend time with the kids, live in the real world, and see what it's like to experience those environments again. And if for whatever reason it doesn't work out, then we issue a refund.
So 75 days for a patient to essentially test drive their technology, right? That seems like a pretty long time.
It is, and that's because we're committed to that rehabilitative process. State law actually requires a 30-day trial period for anyone, but we don't think that's quite long enough sometimes. So we offer an extended trial period of 75 days. If for whatever reason they're not happy, we can issue a refund.
This is so important. So I want to make sure that anybody who's watching this today, they really hear this part, because we talk so often about hearing loss and there's an easy solution, hearing aids. But the reality is that the weeks coming out of wearing technology can be difficult. It is a whole new experience. So I love what you guys do, which is spending so much focus helping that patient acclimate to hearing in a way they haven't before.
Yeah, again, it's kind of like that hip replacement. If you stop doing your therapy every time it hurts a little bit, you're not going to have the result that you want in the long run.
Yeah. Oh, that's so amazing. And I know helping more people hear, as many as possible, is really important to you and your team. So I think you have a special offer for our audience today.
We're going to offer them a $500 discount or 18-month no interest, 0 interest. So that's quite an offer.
That is incredible. If our conversation today resonated with you, call Audiology and Hearing Center at 270-554-6000 to schedule your appointment with Dr. Miliano and his team of doctors of audiology. The great Helen Keller once said, blindness separates you from things, but deafness separates you from people. Don't let another one of life's precious moments be clouded by your hearing loss. Pick up the phone and take back control of your hearing. I want to thank our special guest today, Dr. Tony Miliano. Thank you for joining us in the conversation.
Thanks for having me, Heather.
Yeah, and thank you for watching Hearing Solutions. We hope you enjoyed our half hour together and you have an incredible day.